Lupus nephritis is the specific form of lupus that targets the function of the kidneys. Autoantibodies are proteins that attack the parts of the kidneys that filter waste from out of the body. This causes irritation, inflammation, and swelling of the kidneys. Symptoms can include blood in the urine or foam that forms in the urine due to having too much protein in it. It can also include the swelling of your extremities, like your hands, your legs, or your face. You might also notice high levels of creatine in your blood. Personally, I've had high protein in my urine in the past, and I've also had swelling of different parts of my body, making it difficult to kind of move around. Lupus nephritis can lead to hypertension, a higher risk of cancer, and a higher risk of kidney failure. There's also a higher risk of heart and blood vessel issues. There are several different treatments that you may take if you have lupus nephritis. Steroids like prednisone might be prescribed to help you fight the inflammation. Medications such as Cellcept, also known as mycophenolate, or Lupkynis, also known as voclosporin, are used to help protect the function of your kidneys. If your problems with your kidneys become really intense, you might eventually need to do chemotherapy. I did this treatment with a drug called Cytoxan, and apparently that's a pretty typical chemo drug for lupus nephritis patients to take. Prior to being on Cytoxan, I was on dialysis briefly because I did experience kidney failure at a point. And while my kidney failure was relatively temporary, it's not like that for everyone. Some people require dialysis as a frequent weekly treatment in order to keep their kidneys functioning, at least until they're able to potentially get a kidney donation. Some things to be aware of if you have lupus nephritis: don't drink alcohol excessively, and be wary of your exposure to the sun. Make sure to test for your bone health and for anemia. Be careful of taking certain medications, especially NSAIDs, for pain, because they can potentially interact with your medications and further harm your kidneys. When you have lupus nephritis, it is very important to be constantly monitoring your kidney levels and function. So please refer to your rheumatologist or even to your nephrologist to make sure that your kidneys are operating the way they should be.